Welcome to All Things Public Health with Alvin Capitaco. On this show, we bring you expert interviews, discussions, and stories about public health. Join us as we explore public health topics that are of interest to you, our esteemed listener.
Welcome to the All Things Public Health podcast. My guest today is Martha Haikola, who until recently was the PrEP ambassador for Project Hope Namibia.
I'm a 25-year-old and I was a dream ambassador with Project Hope.
So today we'll be talking about HIV at the community level. Specifically, we'll be talking about something called PrEP Club. So Martha will just elaborate more about that. So Martha, I just need you to tell me a little bit about what a PrEP Club is and how it came about and what you do as ambassadors of the PrEP Clubs.
All right. So PrEP initially stands for pre-exposure prophylaxis. So initially PrEP clubs are for girls that are on PrEP, girls that are taking this everyday pill to protect themselves from getting HIV. So it's a everyday pill, one that needs to take in to prevent themselves from getting HIV. So what to do actually in the PrEP club, like we encourage the girls to stay on PrEP for good adherence. We encourage the girls not to miss their follow-up, come back for a follow-up. We give them moral support. We give them any kind of support that they actually need when it comes to taking the pill, because some they forget, some are suffering from side effects, and some are being victimized because they're taking the pill. So now we give them this support, like if you are going through this, then we give you maybe counseling. If you are forgetting, we put you in a group whereby we remind each other and like that. So that's what the PrEP club does. So we just strengthen the girls to make sure that they remain on the PrEP club so that they do not fall back. So we don't want them to fall back. So we want them to continue taking the pill for good adherence.
Wow, thank you so much, Martha. As you were talking, I just thought about something that I actually forgot to ask you. Are you a nurse by training, or just if you could elaborate a little bit on your qualifications and how you got to actually do this work?
I'm not a nurse, but I got clinical health training on PrEP with Project Hope for about a course of 2 weeks, a full course of 2 weeks on HIV prevention method. But I studied Bachelor's of Arts in English, but currently I'm doing my Master's in Arts in English. So I didn't initially do health, but I got training on health to be able to render the services that I do to the girls.
Okay, that is interesting. And where do you find these girls? Like, if you can just touch on that as well. Where do they come from? What are their ages?
So these girls, we get them with the connections that we have with the CCWs. These are our community care workers that Project Help has. And we get these girls from schools. We can get them from the life skill teachers. We get these girls from the community. We get these girls from the health facilities, because Dreams with Project Hope has their own clinics. So we get them through this. When they are coming for treatment, then we get them. So it's based on the criteria whereby a child needs to be screened first before seen by a nurse. So through this screening, we can see if a child is sexually active, if the child is using alcohol or is abusing alcohol, or if the child is involving in transactional sex. So these are the criteria that one can check for them to see if this child is eligible to take PrEP or not. And the age group for PrEP is from the age of 15 to 25. So 15, we feel like a child of 15 years old is already sexually active. So we cannot ignore the fact. So by then we can encourage the child, but below than that they cannot take.
That was actually going to be my next question. Like, what would encourage, or what would make a nurse to prescribe PrEP to a 15-year-old? But you just said that so 15-year-olds are already sexually active. So, but what I want to know is, they are still minors. They are under the age of 18. So do they come with their parents when they come for PrEP? So how does the whole consent work around this? If you could just elaborate briefly on that.
Through health, we feel like a child who's 15 years old can be able to take up decisions, like can be able to say, yes, I really need family planning, or yes, I can take PrEP. But a child who's younger than that, we cannot. But sometimes if we encounter like problems with the parents and parents asking, why is my child taking this? And then there's always the right people to talk to who understand this more than I do on my level. But for a child who's 15 years old, they can take PrEP, and it's prescribed that it's from 15 years old. So their bodies can handle PrEP from the age of 15.
And while we're on that topic, what are the side effects, and also what are some of the challenges or that keep them from adhering to PrEP? Have you had cases like that?
We had many cases like that. So some or the common side effects could be headache, nausea, fatigue, or tiredness. You're just tired, constantly tired. So this has been a setback now, because if a client experiences that within a week, then she want to drop. But these sometimes they are mild, they are very small, and then they go away. So the body needs to adhere and understand the changes that are happening within the body. So these challenges are caused, these side effects are caused by the fact, like when a child forgets. If I take at 8 and then I'm taking my pill at 9, the body becomes confused. So the body starts reacting differently. So if the child is not taking their medication on time, on the same time, then they might suffer from side effects. But side effects are likely to go away within 2 weeks of you being initiated on PrEP, within you starting to take PrEP. So usually when the client is experiencing the side effects, we always tell them, come back, you can treat them. They are treatable. If the child is vomiting, there's something for the vomiting. If there's headache, paracetamol, we encourage them to drink a lot of water and all that. And then we don't just look at it from the side of side effects, but we also look at it as a side of, like, do you really want to protect yourself? This is about I'm protecting myself. I am trying to put myself on a safer side. So we encourage them. So it's more of the brain thing, that if I'm going through this, I must look at the bigger goal. Like, I want to be HIV free, AIDS free at the end of the day.
Okay, so what are the long-term effects, and how long is a girl likely to stay on PrEP before she decides that she will not be taking this prevention medication anymore?
There's not really a specific time, because if the client finds out that they are no longer at risk, by no longer at risk, I mean that maybe they went for HIV testing with a partner, or they broke up with a partner, this client can always stop. So it's not a long life medication unless your partner is HIV positive. So let me say if I have been dating someone for 2 years and then I've been on PrEP for 2 years, and then maybe the relationship is normal, I can always drop, because now currently I'm not sexually active. The moment you are no longer sexually active, you can actually just drop. But the moment when you are sexually active, you can always restart. So that's a good thing about PrEP. So it doesn't really have a time frame that I should take it within this period. But the longest girl that was actually in my PrEP club that was on PrEP was like for 3 years, that I remember.
And what was her reason for being on PrEP? Was she in a discontent relationship, or did she just feel that she was at risk?
She feels she was at risk, and she felt the need of just putting her life in control, because she said she was going to school and she didn't want unnecessary issues, unnecessary problems. So a lot of girls will be like, it's better to be safe than sorry.
And how old are your girls? Their age? What are the age ranges of the girls that you work with?
So the PrEP club can range from the age of 15 to 24. So we usually don't group them like 15 this side, because we feel like those are all adults, because they're sexually active. So we put now these adolescent girls and young women in the same group. But if we find it lucky that they're only from the age of 20 to 24, then yeah. But we usually just group them according to the sessions. If they're on the same sessions, then we group them according to that.
And then I'm interested to know what the long-term effects are of taking PrEP. Like, is it safe to take it over a long period of time?
it's safe. It's used worldwide. A lot of people are using PrEP to protect themselves from getting HIV. So it's approved, and a lot of information can be found online. So yeah, it is okay for one to use PrEP.
So what I'm interested to find out is if a young girl goes to the clinic and says she wants to be initiated on PrEP, does she face discrimination? Because I know that we've heard of reports of young girls being discriminated for wanting to access contraceptives, and then that would discourage them from going for any contraceptives at all. So what is the situation like when it comes to PrEP?
When a lot of people look at PrEP, they look at it like we're encouraging girls to have sex. When you are initiating this, you're just encouraging the girls to have sex, but that's not necessarily the case. We're actually just trying to give out health education that can be helpful in future. So a lot of health providers, especially government health providers, look at it as a taboo, as a sin for a girl to come to the clinic and say, I want PrEP. And sometimes the girls might not get PrEP from the general clinics because the nurses are unfriendly and they question them a lot. But working with Project Hope with Dreams, we had our own nurses from Intro Health. So they are friendly. So that's why our clinics are called youth friendly. So accessing PrEP is easy. So with us, it was very easy. So you just have to be part of Dreams, make sure that you are sexually active, and then you can access this medication for free. But unlike for government, it's a bit trickier because there's a lot of questions, there's a lot of stigma towards it. But with Dreams, it was really smooth and soft. A girl can just, as long as she's sexually active, she can get that.
So what are the common challenges that they are facing when they are on PrEP? Do their parents know that they're actually on PrEP?
In the PrEP Club curriculum, there's what we call testimonials, and whereby you give when your parents or you told someone close to you how they felt when they found out that you're taking PrEP. And then this always come back with a negative quotation whereby parents go to the extent of even googling what this is. So a lot of girls felt like it's my body and then I decide. So a lot of girls sometimes wouldn't want to share because they don't want to be stigmatized. And the fact that PrEP medication looks like ARVs, so a lot of girls tend to hide now because people say, yeah, you are taking ARVs, you are HIV positive. So those are some of the negatives that we have received from the girls, that people are saying we are taking ARVs, are these ARVs really? But what PrEP really is just a combination of ARV that prevents HIV from taking hold of our body. So a lot of people are being stigmatized by taking PrEP at the end of the day, and our parents are likely or mostly the first people to judge us. So the girls now, they come back. When they come back, then that's when we give them now this counseling, that how do you handle it? How do you handle when someone is saying bad things about you when you know the truth? So
do their partners know that they are on PrEP?
in most cases, some do, some do not know. Because some will say, if I tell my boyfriend that I'm taking PrEP, then he will assume I'm sleeping around. But some cases I want to protect myself because sometimes I might know that my boyfriend is having other partners, or I've been probably being treated for STIs for so long. That means my partner is sleeping elsewhere. So some feel like they cannot share with their partners because it will lead to a breakup, or it will bring someone being judgy now in the relationship that, yeah, okay, so now you are taking PrEP because of this and this and this, probably you are doing this and this behind my back. So a lot of people a lot of my clients now tend to keep this within themselves, that, okay, it's my body, I decide. When I'm ready, I can tell. But there are some certain people that came back with good testimonials saying, yeah, I told my mom, and she was actually saying it's cool. Or I told my boyfriend, and she was saying it's cool that I'm doing this and stuff like that. So not everyone give comebacks with a positive feedback, but a lot do come back saying there are certain things that hinders them from taking PrEP, like stigma.
I'm glad you touched on the other STIs? Because my next question was going to be, yes, the girls are protecting themselves against HIV, but how do they protect themselves against other sexually transmitted diseases as well as pregnancy? So do you also encourage them to go on contraceptives, and what has been the experience like?
If a child comes to the clinic saying, I want to start family planning, so that's already an indicator to you that this girl is having unprotected sex. And then that's when I come in now with the health education of PrEP and PrEP. So what we do is that we do not force the medication on a client. We just tell them the benefits of taking it, and then they themselves can decide if I want to take up the PrEP or not. And it will be so sad when someone decides not to take up, then comes after 3 months, then they test positive. So we try by all means to encourage the girls now to take PrEP, especially those that are on family planning, because family planning clients tend to have unprotected sex. So, but with other STIs, we encourage the clients to take condoms, because we give 3 condoms also at the clinic. And then if the client is having STIs, we also encourage to bring their boyfriends, because we also treat adolescent girls and young women's boyfriends.
You said it's been running for 3 years now. And is it only 5 years now, and it's only in Windhoek?
Wherever Dreams is, PrEP clubs are there. That's now in Commerce, in Zambezi, in Oshikoto, and is it Oshana? So wherever these Dreams containers or Dreams health facilities, then PrEP is takeable, and then there's always a Dreams ambassador to initiate these kind of things. So they're accessible at any Dreams containers, but they're also accessible through health facilities by the government, since Project Hope works with the government also.
But is there proof, or are you seeing is there proof in terms of this prevention effort actually working? I know that you don't necessarily have the data, but can you actually speak to the fact that it has been proven in the Namibian context that it's working?
It has been working, and it has been shown. I cannot really state the statistics because mostly they are not shared with me, but they are rather shared between the nurse and Project Hope itself. But we had numbers of girls on PrEP, girls that are adhering to PrEP, girls that have been on PrEP for a maximum of 3 years. And then this is shown by how girls are called back to give their testimonies through Project Hope and how it has been running. But within myself, I can't really give you the statistics. I'm sorry.
According to the Centers for Disease Control and Prevention, also known as the CDC, PrEP or pre-exposure prophylaxis is highly effective when taken consistently, and it can prevent people who are HIV negative from getting infected with HIV. I know you said that kids are sexually active from a 15-year-old is already sexually active, but in reality we know that they start much younger than that. What other initiatives are there to sort of encourage these young girls and boys to stay safe?
So within Project Hope, whereby with the help of the CCWs, community care workers, the adolescent girls and young women are being told about my future is my choice. Basically just putting your future in control. This is whereby the kids are taught how to use a condom. But usually this is for the kids that are in my future is my choice, because Window of Hope, they're being told about my body, how to protect my body, how to say no. So within those programs, these programs then help the kids to say no. If uncle is touching you in this way, how do you respond? And we also have other initiatives like No Means No worldwide, whereby the kids are being told to defend. If a 14-year-old child is being touched by a boy in a way she doesn't like, what does she do? So these are defending mechanism whereby they defend themselves, not only defending themselves from rape, but also from things like an uncle touching you, a boy touching you. How do you feel, or how do you respond when a boy touches you on your private part? So Project Hope has been putting on these initiatives on how to encourage the girl, to strengthen the girls on how to protect themselves and how to say no.
what would your message be to the nurses at the health facilities who feel like a young girl should not come in and request for contraceptives or PrEP? And then also, from your experience, are parents doing enough to talk to their children about sex and HIV prevention?
With our general nurses, I feel like we should just be more kind. I know we are dealing with a lot of people, it's a lot of pressure on a daily basis, but we shouldn't now be always angry just because. So if a client comes in saying she wants PrEP, rather ask and probe, why do you want PrEP? Instead of saying, yeah, you guys are just being sexually active, you don't want to use condoms and stuff like that. Because there can be certain a lot of things why a child might decide to take up PrEP. With the parents, I feel like our parents are really not open about talking about these kind of things. This can be because of our traditions and our beliefs and stuff like that. But that's the reason why we have things like dreams. That's the reason why we have things like Project Hope. They are taking the parent role. So all I can say on the parent side is for them to encourage the kids to come to dreams, to come to these small events, because these small events are teaching kids more. And then because if our parents cannot be able to say, you know what, Martha, this is how to use a condom, then who else is going to do it? So if these small projects are coming in teaching girls how to use a condom, then our parents should be free and say, okay, since I cannot be open with my child, let me send my child there. So our parents should be supportive enough to say, okay, I'm sending you to dreams. Maybe they will teach you something. Maybe you can come back with something. Because at the end of the day, our beliefs and norms hinder our parents from telling us about certain things when it comes to HIV and sexual activities or just pregnancy naturally.
We are almost coming to the end of our discussion. The other thing that I sort of want to find out is just, what is your message to young people in as far as keeping themselves safe from HIV, pregnancies, STIs, and also those who are positive to say not spread the virus and also live positively with HIV? Your last words.
So I'll start with the HIV positive people. I'll encourage them to adhere. Be on your medication. Take care of yourself, because at the end of the day, it's not the end of the world. There are always people who are going to be supportive, who are always going to look at you for who you are. And for those that are HIV negative, there are always things like PrEP and PEP to protect yourself from getting HIV. So people shouldn't let stigma set them back. Because if every time you hear something negative about something, then you are setting back, then you are moving backwards instead of moving forward. So I would like to encourage the Namibian girls and Namibian adolescent girls and young women to take up the chance to put their lives in control, to be able to say, yes, I am HIV negative, I'm AIDS free. These resources are free. You don't have to buy them. So there's no harm in just walking to a health facility and saying, I want to take PrEP or I want to be initiated on PrEP. And health facility providers' attitude shouldn't be the reason why you say, I'm not gonna do it. So that's my overall message to the people, that if something is given for free and if something is proven to be effective, let's use it.
Thank you so much, Martha, for taking the time to talk to me.
Thank you so much for having me. It was lovely.
And that was Martha Haikola, who spoke to us about PrEP clubs. Thank you so much for listening. Bye-bye.
Thank you for listening to All Things Public Health with Alvin Kapitako. If you enjoyed this episode, please share it with others, post about it on social media, or leave a rating and review on Spotify, Podbean, and other podcast platforms. Also, follow us on social media at All Things Public Health Podcast to engage with us.